Well, as many as 30 million people a year go to the doctor because of coughing.
Boy, this winter, how about it? We've all either had a lingering cough or we certainly know someone who does. UW Health's Dr. Jeff Pothof is here today for his weekly visit. Welcome back, Dr. Pothof.
Hey guys.
Good to see you.
How are you?
So anecdotally, we did this segment just for Charlotte because you feel like you're over a cold or the flu and you're still coughing.
Yep.
So what's going on?
Yeah, so when you initially get cold, flu, whatever virus it is, there's a lot of things that happen in the body. At that point, you can have fevers, muscle aches, sore throats, things like that. But if those things start to resolve, there's a fair percent of people who will have this persistent cough. So you feel better, everything's pretty okay except for lungs feel a little bit tight, you continually cough, and there's really two reasons that happens. One, after you've had one of those illnesses, you'll get some postnasal drip. So as those tissues are healing, there's a little bit of drip that kind of comes back there. Some people can sense it, some people have no idea it's happening. That can generate that cough. The other thing is persistent inflammation. So when you have these viruses or bacteria, they cause inflammation, some damage to the tissues in the lung, and that can take a long time to heal. Now, what people are going to hate to hear is that, normal post-infectious cough, anywhere from 3 to 8 weeks. So even if you're coughing a month and a half after you've had your cold, it's not technically considered abnormal till you get past the 8-week point.
3 to 8 weeks?
3 to 8 weeks.
I'm at 4.5.
Well, you're only halfway there.
Oh my gosh, and it feels like it's never going to end. Like you have the chest tightness. I almost feel like there's like a little knee on my chest. Can't take a full breath without wanting to all of a sudden just cough incessantly, but it's a struggle.
It's a struggle. So things you can do. There's over-the-counter cough medicines.
Do they work?
Yeah,
not
really.
as well as people would think that they should work or how well advertisers suggest that they work. Dextromethorphan's may be your best bet as far as an over-the-counter cough medicine. We have other things, benzenate, which is also called Tessalon pearls. For some folks that might be an option, but it's prescription only. Sometimes humidified air will work a little bit, calm down those tissues, not have them dried out, you cough a little bit less. But it can be tricky, it can be a challenge. Now there's other things that can sometimes cause prolonged cough too. Now, not necessarily in the setting of post-illness, but common causes of chronic cough are asthma. So some people who have undiagnosed asthma, upper respiratory infection will kick it off. Then you'll have this persistent cough, eventually get diagnosed with asthma. People who are smokers, COPD is certainly something that can cause this like cough. People who have heart failure, if their heart failure gets a little bit worse, they get a little bit of fluid in the lungs, they find themselves coughing more often. And then another one, which maybe a lot of people don't realize, is reflux. So when we have gastroesophageal reflux, that can actually cause a little bit of cough as that acid kind of gets in there, hits the back of the throat. So it's not to say that all of these are caused by this post-infectious process, but this time of year, a large proportion of them are.
How can you clarify what it is that you might have so you don't have to waste your time or your doctor's time trying to get in and be seen?
Yeah. I think the big thing you're looking for is my chronic cough, despite how irritating it is it getting worse? Am I finding myself more short of breath? Can I not do the things that I want to do? Maybe, I used to be able to run up my stairs, go to the bedroom, now I'm finding it difficult. Those would be signs that there's more going on than just the cough and would warrant a call to either your pediatrician or your physician ahead of time. If the persistent cough is just there, it's not changing, it just kind of annoys you, it'd probably be okay to wait until you get to that, month and a half, 2 months before you call your doctor. Certainly, if it's going on past that 8 weeks, worthwhile to get it checked out just to make sure there's something else not going on.
Past 8 weeks. Wow. And is it, whenever you're in a public environment and somebody starts coughing, it makes everybody very nervous. You're not necessarily contagious if you're...
No, but you can certainly understand now post-pandemic. I mean, if you're coughing in a public environment, most people are immediately assuming you probably have COVID or something else and you're going to give it to them. But once you've kind of gotten through that initial illness, 5, 7 days, maybe 10 days on the long side, you're not infectious anymore, but you might have that cough that persists.
Can long COVID make you cough?
Yes, so they're trying to figure out, certainly, like long COVID absolutely is associated with this cough. They think it's probably related to the same things that cause long cough and other viral illnesses, namely some drip and things like that. But certainly an area of interest is why, particularly with COVID, do we see this maybe more often than with other viral illnesses, this persistent cough that goes on for weeks.
It seems like your world has just turned into so much different colored Play-Doh that have gotten mushed together that it is hard to peel apart like what is what. It's just everything's just running into each other.
A lot of things present similarly, and that's why
Right.
some of us go to school for half our lives to try to figure it out. And even then, sometimes it's difficult.
But do you think if you're having symptoms, what's your advice? Should you test or just stay home and let it wear it out?
If you're having symptoms and your symptoms are just cough and it's annoying, probably okay to sit on it for a while. If you're starting to feel more short of breath, if things are changing, there is a whole litany of things that can present with shortness of breath and, can't catch my breath, cough, that would need to get looked at. But as long as things seem to be the same, you're probably okay. If things seem to be getting worse, that's when I would get it checked out.
You will get better.
Okay,
It's
now
gonna get
I have
better.
to ask you this. People have said to me, drink a hot toddy. Really? Should I be drinking warm alcohol? I mean, to me, I'm kind of like, that doesn't feel right to me.
There are no randomized controlled studies that would suggest that drinking a hot toddy is beneficial, but maybe for your mental health,
Okay,
there
you
you
can
go.
allow
All
yourself one.
right,
There you
all
go.
right. 3 hot toddies, please.
Yes.
Thank you very much.
Thanks, Dr.
No
Pothof.
problem.
Good to see you.
You bet.